Because telehealth is new for a lot of us, really it's sort of blossomed over the last year or two because of the COVID pandemic, people don't totally yet understand how this works. So let me walk you through the process of how your Winona experience is going to be. So it starts off, you find out about us, and then you decide, gee, this is something I want to look into. And I want to see if I'm a candidate for hormone replacement therapy because I'm having these symptoms that I want treated. So first, there's going to be some questions that are primarily designed to make sure that this is going to be safe for you. We're going to ask you about your medical history. We're specifically asking questions that we know if you have certain conditions, hormone replacement therapy is not safe. And so if you get a pop-up that says, I'm sorry, because of X or Y or Z, hormone replacement therapy is not going to be safe for you. I know that's disappointing, but the last thing we want to do is hurt you. And so it's really important that we do this in a safe fashion. And so that's the first thing, is there's going to be some medical background really designed to see, is this safe for you? The other thing we're going to do is we're going to ask you to choose symptoms. What symptoms are bothering you, so we know what we're trying to fix. Because knowing what the symptoms are helps me know which medicines to choose and even at what dose to choose them. So you're going to be asked what symptoms you have. We're also going to ask some other questions about certain things. Are you pregnant? Are you breastfeeding? Are you using birth control? Other important questions. Once we have all that information, I have built an algorithm based on that information that will suggest a treatment for you. Now, that's going to suggest the medications. It also may suggest the route of use, but a lot of that also has to do with your personal preference, whether we're going to recommend a cream or a patch or a pill for you. And so we'll recommend a given treatment, and then we'll see how you feel about that. Does this sound good to you? And then you'll decide, gee, do you want this sent out every month, or would you rather do it every 3 months? We do give a discount for a 3-month subscription rather than a monthly subscription. So you have to decide what's going to be the right way for you. Once you've filled that out and decided, yeah, this looks good, it's not a guarantee you're going to get that, because the doctor needs to review that to make sure it's safe and it's going to work. We don't want to give you something that's not going to work, that's not the right medicine, and we certainly don't want to give you something that's not safe. But we ask you, gee, if the doctor decides, yeah, this is okay for you, is this what you want? And you'll say yes. And then we're going to ask you to upload a copy of your identification and a selfie or a picture of yourself. And this seems kind of weird for some people. It's like, I don't want to give you my ID, but it's really important because legally we're not allowed to write prescriptions unless we've verified that this really is you. And so we verify that by seeing your ID, making sure it matches up with your picture and your date of birth. So it's going to be really important that you do that, because legally we can't prescribe medications without it. So you'll upload a picture of your ID and a picture of yourself. It's important I can read the ID and read the birth date on it, so don't make it too fuzzy. And then you'll upload your credit card so that we can bill you for the medications. Once you're done with that, then it goes into the doctor's queue, and we'll see, hey, there's a new patient. And so we pull up your information, we look over everything, we make sure the algorithm was correct, we make sure that it's safe, make sure that the right medication is chosen. And if everything looks good, we'll go ahead and prescribe those medications. You'll get a text or an email saying, or a message on our platform saying, the doctor has prescribed you these medications. That prescription electronically then goes to the pharmacy, and at that time your credit card is billed. The pharmacy fills those prescriptions and then mails them out to you. We use priority mail, so it should get there in about 2 days, sometimes 3, depending on how slow or fast the mail is at that time, and it arrives at your doorstep. At any time, you can ask a question to the doctor, so you'll message the doctor. The doctor will see, hey, there's a message, they'll read your question, and then they'll answer your question. You actually, in my opinion, have more access to the doctor than you do in the traditional go to the office healthcare setting. I know that I'm very responsive to the messages and do my best to answer them as soon as I see them come up. I, of course, don't live at my computer, but my wife says I do. But so, there may be an hour or 2 or 3 delay. If you write me a message at 1 a.m, I may not get to it until I wake up. But in general, we try and answer those questions very quickly and right away, and as thoroughly as we can. And there's certainly back and forth that can happen. Now, occasionally we'll see something on the health form where you'll ask a question. And so before we write a prescription, we'll clarify something. gee, you said this on your health form. Can you give me more information about this? Can you tell me more about this? And again, we want to make sure that this is going to be safe for you and that we're writing the right prescription for the symptoms that you're having. There's also a section as you're filling out the form to say, is there anything else that you want the doctor to know, or do you have any questions for the doctor? If you do, please put them there. I want to answer them. And so if I see everything looks good and I'm totally happy prescribing you this medicine, I think it'll work, it's going to be safe for you, but you have an important question, I'll answer that question before I write your prescription, because I want to make sure, number one, you understand what you're getting, and number two, you feel good about it, and that you trust, this is safe for me, this is the right thing. And so I want to make sure that you understand everything and that your questions are answered, because it's important for you to understand what you're putting in your body, why you're doing it, why this is safe, and why this should work, and also how to use it. And so answering those questions back and forth is important. At about 2 weeks, we're going to send you out a message basically checking in. Now, I don't really expect you to have, all your symptoms fixed. Most women actually don't feel any different at 2 weeks. Some do, but some don't. And so really this is just to make sure that you got your medications okay, you understand how to use them. Are there any questions about how to use them? If everything's going well, you don't have any questions, you don't need to respond to that. You certainly can, but there's really no need to. But if you have questions or there's some issue, please respond right away. And then we check in at 3 months. And so I designed this the same way I do things in my office. So if you were to come to my office and I were to write you for a new prescription for hormone replacement therapy, I'm going to ask you to come back in 3 months so I can see how everything's going and make sure the dosage right, the medicine's right, you're not having side effects, things are okay. And so that's what we do online. At 3 months, I'm going to send you a little questionnaire that's designed to make sure that this is working, that you're satisfied with the results, that you're not having side effects or any other problems. If everything is good, then I'll renew your medications for a year, which is what I do in my office. So if you're in my office, you come in at 3 months, you say everything's great, I'd say perfect. I write your prescription for medications with a year's worth of refills, and I'd see you back every year. And that's what we do online. And so if at the 3 month point everything's great, we write you for a year's worth, and then we do it again in a year and check in and make sure everything's okay. Now that's how I'll check in with you, but you are certainly welcome to ask me a question or check in with me anytime you want. You don't have to wait for that 3 month appointment. You don't have to wait for the 2 week. You don't have to wait for the 1 year. If there's issues or questions, please message me right away, because I want to get those addressed and make sure that you're doing well and that this medicine is working for you and working for you safely. So don't hesitate to write a message and ask me questions. That's what we're here for. And we want to make this experience safe and effective for you, but also give you a good experience and treat you respectfully and make sure you understand what you're getting and what you're doing and why. And I'm not satisfied until I know that you're satisfied and understand what we're doing and why, and that you agree with that treatment option. So there's a thing in medicine called shared decision making. And the idea is that I see my job more as an educator. My job is to educate you, explain what the issues are, give you what I think is the best treatment plan, but then your job is to choose what's right for you. And so pushback is okay. Let's say you've had a hysterectomy and I think, gee, estrogen and DHEA is the right thing for you. And you say, yeah, I want some progesterone. And then I'll say, well, what are you expecting to get out of the progesterone? And you say this. I say, okay, it's safe and it may be effective and you know your body well. Let's try that and see how it works. So back and forth and shared decision making is important, because ultimately this is your body and we want to make sure that you're getting what's right for you, and nobody knows your body better than you do.